Some people think that they've done a shockwave treatment, but the device that they were using really isn't shockwave at all. And it's a really big problem, I feel, in the industry with manufacturers and how some of the terminology is made, because some of the devices that go by a generic shockwave name really don't produce a shockwave. So it's important to know the device that you're using, is it a true shockwave, and is it doing what you think it's doing? Because a lot of them are what's called a radial device. And that radial device, as we look here on these two pictures, we've got pressure right there. And so when it shoots the wave, depending on the amount of pressure in a certain amount of time that it produces, that's going to dictate if it's a true shock wave or not. So radial devices can hold a special application, but especially for depth of penetration, as we see here, you're going to get a lot better depth of penetration with that focused shockwave device. There's also literature showing how true focused shockwaves really don't produce any tissue damage, whereas radial devices can create a little microtrauma, which isn't always a bad thing, but sometimes not the thing that you want to do necessarily. So we can see with true shockwave devices, that big shot of pressure is what really creates the difference with, say, the focused devices like we have with Softwave and the newer curative sound device. So if you're doing an application for musculoskeletal complaints, especially if it's a nerve-related complaint, you definitely want to have a focused device and not necessarily a radial device.